Joe, I think before everyone gets too excited, there's two parts to the story. The one is, yes, there's good news for some cancer patients or those that are going in for screening, for example, because you have these 15 new cervical cancer machines. They're valued at about 60,000 Rand each. So the department has forked out just under R1 million to get these machines into particularly rural hospitals. And obviously, the staff in those hospitals are being trained to use these machines. This is largely for the screening, also the prevention of cervical cancer. But then on the other side, you still have this issue of the oncology crisis that we have in the province. So this is by no means, a wand that the MEC can wave or use to wave away this cancer treatment crisis that we have in the province, although this will go a long way in helping patients with cervical cancer. So today the department unveiled those machines. Those will be put to use quite soon. They'll be spread out to those hospitals, like I mentioned. That will reduce waiting periods quite significantly, particularly in those outlying areas, which will then benefit patients in those areas. But coming back to this issue of oncologists, Joe, that is still a very, very real problem. The MEC, Spongiseni Tlomo, says that they are now waiting for recent graduates to complete their training so that they can get into the system to bolster the situation at the moment, just to get them working in these hospitals. He's also mentioned that there is a new radiotherapy machine that will be functioning at the Addington Hospital, at least by next month. That's what he says to us, because this comes after the issue of the machines not functioning there for the past few years. You'll remember that that caused quite a bit of controversy because there were lots of delays and ultimately patients died while waiting for that radiotherapy treatment.
Dasen, how long will the department have to wait for these new oncologists to come into the system?
That's just the thing, it's very difficult to get answers out of the MEC in that regard. I tried today, in fact, I put a question to him, just talking to him about how he has been dealing with this issue of both the shortage of oncologists and as well as the issue of the machines, those radiotherapy machines that I mentioned. But unfortunately, he did sidestep that, saying that, the issue of machines, for example, is an old issue and it's not, and now the department is trying to move past that. But this is not something that you can just move past by bringing in 15 cervical cancer machines now, because there's still the issue of other people having died while waiting for treatment, particularly radiotherapy in that case. So we don't really know when these oncologists will be ready. We understand from what he was alluding to earlier on that it should happen soon, because we understand that they are in training at the moment. But he did say that in terms of the equipment, there should be a functioning radiotherapy machine at Addington Hospital at least by May. He was quick to also say that the delay in getting that machine working was not the department's fault, but it was actually the manufacturer which delayed in getting that machine to the department. But we also know that last year the Human Rights Commission had forced the department to get its act together in order to get that treatment going at Addington Hospital, because it's just been a huge mess over the past few years, especially after those two brand new machines stopped functioning in 2012, and there was another service provider that was brought in as well to fix that machine, those machines which made the situation even worse. So one can only hope that this is now the beginning of the resolution to this crisis that the province is facing, particularly when it comes to cancer treatment and also the shortage of oncologists.